Yes, 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 doctor.
Amazing. Thank you so much. So, so to start with, my name is Hesham Ibrahim. I'm one of the emergency medicine consultants in Hampshire hospitals in United Kingdom. And today I've been given the task to try to cover shock in less than 50 minutes. So I'll try to do my best, but that would be a big challenge because shock is a massive topic. So what I will try to do during the next half an hour to 50 minutes is to cover some pathophysiology of the shock to get some more deeper understanding of how shock happens and what happens exactly there. So we can have a general approach about how to handle shock when those patients present undifferentiated. So plan is a bit of chat about the shock itself. Then at the end, we're going to cover a couple of cases so we can apply what we've talked about during the day. So let's have a bit of an overview about shock first before we move on. The first question to be asked is, do you really think that it is important to talk about shock now? Is it important to know about shock? If you're not really sure about the answer to this question yet, all what I'm going to say is I've been following the talks of the symposium since yesterday, and I don't really think that there was one single talk that the word shock has not been mentioned in. So this is how important shock is. Shock is a very common presentation in ED. You cannot really practice emergency medicine without really mastering how to handle shocked patients. Sorry, can I just ask for everyone to be...
قلت لك اجي اخرجهم مش نبدا بعد هذا.
Okay, so let's move on. So shock is the final common pathway before cardiac arrest generally. So every cardiac arrest patient that you're going to see probably have been through some sort of a shock before arriving to you and reaching the cardiac arrest state. And if you do not treat shock, then the next step is going to be multi-organ failure, then death. But the good news is it is a reversible condition. So if you can detect it early enough and you start treating it appropriately, then you can reverse it back. So to start with, let's start with the definition of shock and see what shock means. Shock is basically a circulatory phenomena. It is a failure in the circulatory system. It is an abnormality in the circulatory system that results in an inadequate organ perfusion and tissue oxygenation. So you've got a failure in the circulation resulted in inadequate perfusion to the organs and loss of tissue oxygenation. And this in turn will result in failure of the aerobic metabolism and the start of anaerobic respiration at cellular level. And this will result in lactic acid production. And then this will progress to cause cell death and multi-organ dysfunction.